So for this session, we're going to learn how to look at the internal jugular vein and assess JVP with ultrasound. So obviously you want to do your physical exam and see if you can see the JVP. But sometimes patients have very difficult anatomy because they're either obese or they have really thick necks or short necks. So sometimes it's easier to look for the JVP with ultrasound. It can be a good adjunct to your physical exam. So we're going to be using a linear probe once again. It's superficial. It's a vessel. So what we're going to do is we're going to have the patient at a 45-degree angle on the bed. All right, and we're going to have them look to their left side. And after you do a physical exam, you can use ultrasound to see if you can assess the JVP. So we're going to put the ultrasound probe on the lateral part of the neck, and as you see on the screen, there is a few structures right there. Okay, so most lateral is going to be your vein, and right next to that, underneath that, is your carotid artery. And as you go more medial, you actually start seeing thyroid tissue. And if you even go even more midline, that's the trachea right in the middle right there. Okay? So trachea, thyroid tissue, there's a carotid artery right in the middle, and over here is your internal jugular vein. And that's the vein you're going to be looking for when you're assessing jugular venous distension or pulsation. Alright? So how you can access this is you can either look at it this way in a transverse view, okay, and then you can march up until you see it, the veins start tapering, which is right about there. Okay. Another way you can do this is you can actually look at the vein and then turn on it 90 degrees, so you get a longitudinal axis, and you can see right there that is the internal jugular vein, and where it tapers off is where your jugular venous pulsation is going to be. All right, and that's right in the middle of the screen is where you would mark where your JVP is. All right, so once again, here's a transverse view right here, and I'm going to turn 90 degrees, and you can see it taper down, and right in the middle of the screen is where you're going to call your JVP. And if I was going to mark it, I would mark it right in the middle, right here. That was where his JVP would be. All right, and that concludes our session for the JVP exam.